just ask you, why do you think the government has brought in the new Plan B restrictions today?
Well, my understanding is that Keir met with the chief medical officer and the scientists yesterday, and they're very clear that this new variant is spreading fast throughout the UK, and therefore these measures are necessary. We felt that the government should have acted sooner on things like, the Welsh government brought in vaccine passports and the requirement for testing for large venues some time ago. That gave the industry opportunity to respond to that. And we also think the government should do more around sick pay and brought in measures so that people could self-isolate when they needed to, and ventilation in our schools where we know that the virus spreads quickly. So we think that we have to act because that's what the medical and the experts are saying we need to do. The Prime Minister, though, has completely undermined that with his actions over the last couple of days.
Yeah, well, we'll come back to that in a moment. You say that the medical advice and the science is telling us this. There is no evidence whatsoever that vaccine passports prevent a surge in cases, or indeed that mask mandates prevent a surge in cases. We've seen that in Scotland, in Wales. We've seen that in France, Italy, Germany, Austria. Why on earth do you think that the data backs up those measures?
Well, we're following the advice of the chief medical officer and the scientists who say that this will
they
be.
Say, well, in terms of the evidence, that do you, when they say to Keir Starmer or to you or to the government, this is what we think you should do. Does Keir Starmer, does anyone ever think to say, can you show us the evidence for that, please?
Well, clearly there is evidence that mask wearing does reduce the amount of infection rates, and therefore we've said that people should be wearing masks. And obviously, if you're going to an event there lots of people are going to be gathering, then making sure that you've had a test that shows that you don't have COVID is, a diligent thing to do, because obviously if you've got an infection and you're going to a mass event, then the likelihood is that you're going to spread that infection around. So these are pretty logical steps. If you've got
someone testing before they go to an event is very different from vaccine passports being required.
Well, vaccines do reduce the risk of you contracting the COVID virus. They're not 100% though, and this is why we said that negative testing is important as well, and that people should be able to provide a negative test for these events as well. If you go into a mass event, like I say, and you're mixing with people, especially indoors, the medical and the science advice is that this new variant in particular is very adapt and very easy to catch. So therefore, we have to make sure that people, don't have the virus and are not spreading it at these events.
Given the concerns about this new variant, is that particularly that it's more transmissible, and concern that it may evade vaccines, I'm not quite sure why vaccine passports would in any way help in dealing with something that may evade vaccines. But this is more transmissible, as it does appear to be. We're told Saturday we could see up to 1 million cases a day. Given that every single prediction from Sage, from Neil Ferguson, from everyone, from the moment we started this pandemic, has been proven to be wrong on a huge scale, why are you still trusting those predictions?
Well, it's very clear also that we were told by the Health Secretary that the science in the last 24 hours say that where you do have a booster jab, that actually that does protect you more against this new variant. So first of all, I'd say people should get their booster as quickly as possible, and that vaccines do work to try and stem the severity of the COVID virus and will protect people. So people do need to do that. And you do need to follow that advice. The health service has been doing a fantastic job of protecting us and looking after our loved ones and caring for us we need.
Has it? 740,000 missed cancer referrals during the pandemic. Mental health overwhelmed. People waiting 12 hours in an ambulance to go into A&E. What do you mean the NHS has been looking after us well? Most people can't get an appointment with their GP.
Well, the NHS has been doing everything they possibly can. And this is the point, Julia, is that if we're about to hit the winter months, which is always difficult for our NHS, so therefore to allow the virus to run rampant and not to do our bit to try and stem the flow of that will put added pressure on the NHS. And therefore there'll be more waiting times and more, terrible circumstances. I had one in my constituency of Ashton-under-Lyne where somebody died waiting for an ambulance for 50 minutes. I do understand that, but that is not the fault of the doctors, nurses, and our ambulance staff. They are doing the best they can in the circumstances. We have to try and support them. And if the medical saying that we need to take these measures, then we have to do that, because we don't want people waiting for cancer treatments because they can't get that treatment because the NHS hasn't got the capacity.
Well, they haven't been getting that treatment even when the NHS did have the capacity. Let's talk about these Downing Street parties. I have suggested today that it would be quicker for Downing Street to just tell us the dates they didn't have parties on last November and December, given how many there seem to have been. Given Allegra Stratton has resigned for, we understand, laughing on a video about a party that the Prime Minister still denies actually took place. And we've now got the Cabinet Secretary, Simon Case, holding inquiry into a party that the Prime Minister still denies didn't actually took place. And the Metropolitan Police have been asked to investigate, and the government said they will cooperate if there is an investigation in a party that we're still being told didn't take place. Do you think that this party that didn't take place is the reason why we are having these new measures?
I don't think that's the reason why, because, like I say, Keir Starmer spoke to the chief medical officer and the scientists regarding why we need these measures.
There was no plan for Plan B on Tuesday. The cabinet meeting that they had, there was no discussion of Plan B being brought in. There was no discussion of new data or new issues that were being raised. There is no new data from anywhere around the world, South Africa, America, Israel, who are doing studies anywhere that would prompt this. This measure was brought in immediately after this party story emerged. There was nothing that changed in the data in that time.
All I can say is, in terms of, I'm not sure what the chief medical officer was telling the government ahead of that announcement and how long they've been telling them, but they're very clear that the data that's showing now in the UK is that we do have this new variant in the UK, and it is spreading very quickly and spreading at a similar rate to what was happening in South Africa, and that therefore we need to do something and take action on that.
Did you know that in South Africa cases have already peaked and have started to go down without a single death?
Well, that might be the case for South Africa, but I'm following the advice of
But in South Africa, where only about 24% of people are double jabbed, the cases have gone up and have started to go down without a single death. But we, with a vast majority of our population vaccinated, do you think things will be worse here?
Well, we've got to follow the advice of the chief medical officer and the scientists here. We know already, as you've already outlined, our NHS is under incredible pressure. And therefore, if we have high infection rates here, then that can cause problems. The chief medical officer is very clear on what he thinks we need to do. And therefore,
can I ask you, go back to the parties, should there be a police investigation rather than an internal investigation into this whole spate of Downing Street parties in November and December? And if so, should people face prosecution?
Well, nobody's above the law, and therefore it can't be one rule for everybody else and one rule for the Prime Minister. People are being prosecuted for events that happened around the same time within the court. Now, I think I asked last week for the Cabinet Secretary to investigate, and the Prime Minister said nothing to see here. He's taken over a week and a leaked video for him to decide that something did happen. And now we found out that there was even a potential party at the flat in Downing Street in the Prime Minister's own house that he didn't know about. I find that incredulous. We do need that investigation. We need the Cabinet Secretary to bring that evidence forward. It can't be that difficult to find the evidence. 40 people wearing Christmas jumpers, Secret Santa in, and CCTV around Downing Street. That evidence should be handed over to the Met Police, and therefore nobody is above law, and the Prime Minister and anybody else that's been putting these rules forward. And let's not forget, people couldn't see their loved ones who were dying at this time, and therefore they dealt with in exactly the same way as everybody else who breaks the rules.
Absolutely. Angela Rayner, a Deputy Leader of the Labour Party, certainly agree with you on that final point. Really appreciate you joining us.